about to needle the QL muscle. Now a lot of people will freak out a little bit when they're needling the QL because they think it's right near the kidneys, yeah? So it's very easy to avoid the kidneys. Needling anything in the body is safe when we understand our anatomy really well. So it's about knowing where things are, where we shouldn't put the needles and where we should put the needles. So I'm going to walk you through the process of needling Quadratus Lumborum. Okay, moving on to needling the Quadratus Lumborum now. So this muscle extends from the lower border of our 12th rib down to the iliac crest and also on the transverse processes of the lumbar spine. This muscle, as we know, is very much involved with stabilizing the lumbar spine. It also helps with lateral flexion and extension through this region and a little bit of rotation. Trigger points in this one, we all get trigger points in our QL based on the way we carry our body, the way we live. Like sitting can tighten up the QL. Often we can find them out on that lateral border. So we're going to do a needling technique for the lateral border of QL. So basically we're going to roll off of erector spinae, drop down, sink in one level, and you start to feel that lateral part of QL. And you can roll off the edge of that and then push medially and in, and you should hit that lateral border. So you want to feel and get a sense of where that lateral border is. If you don't confidently feel the edge of that muscle, like I've said before, you want to make sure that you never needle a muscle you don't feel super confident about palpating. So you want to know where you are in the tissue and have a really good sense of the depth of tissue that you've got to play with. So we're going to use that edge of the muscle as our point that we're aiming for. We come off the edge with the needle and we point it in towards that. So we're going to be aiming for the trigger point on the very outside edge of the lateral border of QL. A good sized needle for this one is probably going to be about a 50mm needle. That's usually, in most cases, will give you enough reach to get in to that muscle. We palpate. I'm going to drop in right next to where I've palpated so that I don't touch where I've cleaned. The angle of the needle is not dead flat, but pretty close. It's about that 10-15 degrees angle as we approach the tissue. There's quite a bit of density or thickness of tissue here to play with, so don't be too concerned about going too deep. And if we use that flat angle, it's going to keep us nice and safe and not go too deep into it. And you'll feel the needle glide through the tissue quite smoothly until you hit the edge of that QL. You meet a bit of resistance, and we want to try to elicit some of those symptoms that we got through palpation when we were touching that muscle before. Once you find that trigger point, we either let the needle sit and deactivate the trigger point, or we can produce some symptoms with some pecking. We get a little twitch from that one, or you can insert it into the muscle and potentially wind it up and do a little myofascial stretch, and that'll grip the tissue there. And that's how we can target that lateral trigger point in the lateral belly of QL.